Hi, I'd like to welcome you to the Protecting Hands massage video. This is a training video for the attendees of the course on the 23rd. I'd like you to go through this video with the handouts, making any notes and any questions, and bring them with you on the day on the 23rd, and we can then explore those questions. So let's get started and move on to the beginning of this video, which is working out how the goals of the day will be. A bit of history about massage we will be exploring, research regarding damage to hands, some work on our body mechanics, because we need to know how our body mechanics are working with these moves, and you'll find that when you actually do the work on the day that the body mechanics are very important to make sure that we get the right depth and we're not damaging our body when we're using these techniques. So if not hands, then what? So we'll be using the techniques to work on the back, neck and shoulders, the glutes, legs and feet, the pectorals, arms and neck, and I'm going to introduce a new move in there. I have used it on clients, so if you've had a session from me you may have actually experienced it, but I'm now introducing it into the workshop. And then we're going to look at the last part, which is the front of legs and the feet. So the bit of history first. Per Henrik Ling was considered to be the link to Swedish massage. That's where the name came from. Obviously he was Swedish. He developed techniques that were used for athletes in the sports massage area. So there's our link to sports massage as well. So this is why some of the moves that we do within the Swedish massage are taken into the sports massage arena. But they then use elbows and so on, which we don't use and we should never use. So there's the connection. Since that time, obviously there have been lots of other people bringing in different techniques, developing techniques to get into the deeper tissue of the muscle. And some of those people are, for instance, Dr. Matthias Roth. He brought Ling's work to the UK after his death. He produced a book in the 50s, which was then really bringing the link to us for Swedish massage. It really emphasized the word Swedish massage, which is where most of the courses that are run now are based on that name, although they really should be more therapeutic and so on, and it encompasses too many variations of massage, which we'll explore a bit later. So Dr. Charles, there's Charles and George Taylor, who then learned from Dr. Roth, and they took their techniques to America. But in fact, the Americans have really taken on board the idea of massage in a far bigger way than we have here. There's more courses. They're actually linked to the medical profession, so they've really taken it on board and realised the potential of it. But we're still a little bit more flimsy with our approach to massage, and we treat it still a bit flippantly. Although my view is that it's probably one of the most important therapies that we have available to us. And if we go back to touch is so important, and we're losing that ability to touch. Okay, then we go on to Dr. Johan Mesger, who he had a more medical approach. And I think this is where some of the idea of, there was a French connection here. And he introduced the names, the effleurage, petrissage, tapotement, friction, vibration. He introduced all of those sort of words to explain techniques. But there's really there's no clear understanding here why he adopted those terms, but that's what he used. I mean, effleurage is very much about stroking, petrissage is moving deeper into, and tapotement is a form of like a drumming. So there we are. There's some links there, but the techniques were really taken from his idea, and it was a more medical approach to the whole idea of massage. There are obviously others, but we can still see here that the core basics of massage, as we're teaching it today, is emphasis on hands and fingers, and I think that's the bit that we want to explore today. So types of different massage techniques. Let's have a look at some of these, and there's some really misunderstandings going on in some here. Lymphatic drainage, for instance, is as it says here, gentle massage intended to encourage the natural drainage of lymph from the tissue space. So yes, it does that, but also, as we've explained when we've looked at anatomy and physiology here, if we move muscles, then we move lymph, because the lymphatic drainage must move with muscle movement. So therefore, all you're doing really with any massage is lymphatic drainage. But these techniques have been really adapted, and the name has been taken on board so people can teach it and make more money from teaching these type of courses. But if you do a very good massage and a full body massage, then lymphatic drainage is happening. Spa and holistic is a light flowing massage, and that's where we get into this feeling good factor, which is great, no problem with that. And it is mainly used in spa or holistic type of environment. Acupressure is a bit more now medical, because we're now applying pressure into muscles. We're looking at the structure of the muscle, where we're also looking at where the acupoints are in the body. So we're taking into different areas now. We're looking at meridian points, and how they, if you massage meridian points, how they can stimulate the chi or the energy through the body. So with acupressure, it's a little bit more technical. You have to learn more about the structure of the meridian lines and where the meridian points are. Very well worth doing. I use acupressure in my massage quite a lot, especially around the neck and shoulders, and sometimes on the legs as well. Neuromuscular is okay. So where we're putting pressure onto the myofascial points, this is more like these two areas are connected: neuromuscular, myofascial. Neuromuscular is actually making the nervous system stimulate the muscle itself. So what it does, as we go into the and if really, in a sense, is what Tapoutman does. Tapoutman actually will stimulate the muscle, stimulate the nervous system within the muscle, and make the muscle contract and expand very quickly. And then, in doing so, will release some of the toxic waste from that muscle and allow then the tissue to repair. Don't forget, there, as we go back to our anatomy and physiology, the structure of the muscle is myosin and actin going across each other, and if that structure is prevented from moving freely, then we will not get a muscle that is that's comfortable, and that's where pain comes in. So by actually removing this toxic waste from the muscle, we then get the muscle to move easier. That's what neuromuscular does. Myofascial, very similar. We get increased circulation, lymphatic drainage. This is a way of stretching the muscle, and I'll show you how we do use some of the myofascial release when we do some of the legs with the hands free. And then we have the last one, which is deep tissue massage. This is where we're it's really a combination of all of these, really, because deep tissue is working really just to release adhesions in the muscle, and that obviously in turn releases pain, and it restores the normal movement in the muscle. So when we get a muscle that is restricted in movement, so we get less movement, say for instance an arm, and you can't actually get the arm to move in a particular way, then we open the muscle, extend the muscle, let the muscle move freely, and then the arm structure, the bone structure, can move better. So really deep tissue is really where I do a lot of my work, because most of the people that I work with have problems within their body that they want to release. So do we or should we always do what we always did? So what I mean by that is, should we always be doing what we know, or should we be breaking out of the mold and taking it into different areas? And I think there's now very good evidence that therapists are leaving our business in droves, and this is actually, there's been quite a few different articles I've read about this where people are leaving the industry. I know quite a few people who cannot work anymore because they've damaged their hands. So there was an article that was in this, and you can see the link at the bottom here, themassagetherapy.com. If you go on there, this is a long URL to copy, but if you just go into massagetherapy.com and look for articles and then look for injuries, you'll see something related to this, and you may even see some more modern research has come out of it. But I'm going to read this because it's really interesting, because it says the incidence of occupation-related injury among massage therapists and body workers has been reported in a number of books on massage and bodywork. Remember, okay, it's been there and it's been out there, but no one's still doing anything. and in the major massage industry magazines, including Massage and Bodywork magazine. These publications have provided anecdotal and empirical evidence that occupation-related injuries affect a large number of massage and bodywork practitioners and can even occur during training at a massage school. And that's what I want to emphasize on, is that even schools are teaching people to use their hands and fingers and thumbs and creating damage even while they're actually on the course. So people are leaving. I know for a fact that 2 or 3 students I was working with, when they left the course and started working, they could not work anymore because of the damage to their hands. They did the early classes I did, early workshops where they did the hands-free, and now they're using those techniques very, very successfully and carrying on their business, and some of them are very, very successful. So it's just going to show that if we can actually keep that damage to the hands to a limit, so that we can use our hands for the times that we need them. I still use my hands, but I still do most of my work now with my arms, and I'll show you the techniques that we're going to use here. So where do we go from here? So first of all, we must take note of our body mechanics, and I think this is what is really important. So in between times, I want you to start thinking about how your body is relaxed, how your knees are soft, never lock them, lower the spine, we drop the spine, we loosen the glutes, shoulders and upper body loose and flexible. So if you are doing massage now, really pay attention to that, those elements here while you're massaging. And also just take some time just to stand, let the body relax, feel into the knees, feel the knees softening, then lower the spine, and then just loosen the glutes, and then shoulders and upper body, and let the whole body then become loose and flexible. And I want you to be thinking about this before we get there on the 23rd, because it's really important. So some exercises. We want to locate the soft muscle of the forearm. That's where we're going to be working. So what I want you to do now is just hold your arm out in front of you. Don't want you to tighten the muscle at the moment. So I just want you to hold your arm in front of you and just feel, so your hands up in front, your hands just as the picture is on the left. I want you to present your arm like that, and just feel in to the pad that you have, that large muscle, and you can see then underneath the skin you can see the construction of that muscle. Now I want you to tighten the hand and just feel into the muscle again. So what do you feel? You should be feeling a very tight muscle now, and if you release it again, you'll feel the muscle loosen. Now that's really the bulk of our work that we're going to be doing, is using that very big muscle, and the techniques we'll be using will be around that muscle. So now we go on to if we locate the hard back of the forearm, you can feel the ulnar and the radius. So you should be able to feel the ulnar and the radius beneath the surface. Now as you rotate the arm, you can feel these bones going deeper or coming to the surface of this harder muscle group. And again, if you feel the hand relaxed, feel the softness of the muscle, and then tighten the muscle, feel the tight of the muscle. Now rotate again, and you can feel more of the ulnar and the radius. So again, if you release the hands, the muscle will spread out and the bones go slightly deeper. So that's what we're looking for. So it's the ulnar and the radius of the forearm, so the back of the arm, and that's what we're looking for. So feel the difference now when you press the posterior and anterior forearm onto the different surfaces. So first of all, let's press our arm down, hand facing downwards. If you're near a table, push the belly of the arm and the hand onto the table and feel what it feels like. Now rotate the arm, so we now got the posterior of the arm, and just feel again, push into that, feel the difference on the table. So this is what we're actually going to be using. We're going to be using these two areas of the forearm. So one's very soft and very absorbent, and but it can actually, when we can adjust it by adjusting how we move our hands, and the back of the arm, we can use some of this ulnar and radius to get into areas of deep tissue that's protected. There's no bone there, but we can get in quite deeper into the deeper tissue there with that part of the arm. So now let's have a look at the next part, which I want you to start really being careful about here. We're looking at the olecranon. The olecranon is running up to the elbow, but we don't want the elbow itself. We want the bone that's running from the joint down towards the hand. And if you lay your arm on your thigh and palm down, then lift your hand slightly and push down, and you will feel this bone pushing into the tissue of the thigh. Now what you need to do is lift the hand right up, and now you can feel the elbow, and that's going to be a lot more painful than if we use just the olecranon, which is the section coming away from the elbow. So practice that. I want you to be practicing this before we meet on the 23rd, that we're actually working on the olecranon and not the elbow. So we don't want to be pushing in into someone's body with that very pointed bone, and it will actually cause quite a lot of damage to the muscle. It would really distress the muscle, and it will cause it to go into contraction. And then if it's in contraction and you still work on it, you'll then start ripping the myosin and actin against each other. So we really don't want that to happen. So be very, very, very careful about working on this. We're going to go through this on the day as well, so we'll make sure that you totally understand it. So don't feel worried about anything before we get there on the 23rd, but just keep practicing and understand where this part of the bone structure is. So let's now look at another part of the arm, which is really what we're going to be doing here is we're going to be still using this section of the arm, but we're going to use it in a way that has got some strength from behind us. So what I want you to do now is outstretch the arm in front of you, and just with the hand facing up, and I want you to just drop the elbow, draw the hand back to your body to form a V between the upper and lower arm. And what we're going to be doing then is, if you rotate the hand so it's actually facing across your body, we will be using the belly of that forearm, and we will be using that onto various parts of the body to stretch the muscle and stretch the skeletal system. So we use it a lot over the shoulders, but it's for a whole body push. This is where our body mechanics come into it. We must get our body mechanics right here. Otherwise, we're going to be damaging ourselves as we try to help our patients. So be very careful about how we use this section. So if you're going to try and use this, what I would suggest is pushing against, so open a door and push the arm against the lady, put the arm on the door frame and just push forward and feel your body movement going into that muscle and pushing. And so you can see the strength that you can get behind it if you use the right body mechanics. So I have a practice with that one as well before we meet on the 23rd, but we will be going through it again on the day. Now, this is the section that I want you to watch, and I want you to go through it 2 or 3 times. Just really make sure you understand this part of the body. Make sure you understand how we're using this, the parts of the body that we're going to start using in the techniques. So that's the section for now. So make notes, draw down the notes that I'm going to send you. Make sure that you write notes against. I'll send it as in a form that you can. There'll be in a PDF form that you can print out. Write the questions that you have at the side, or any notes that you want to bring with you. But make sure you bring them on the day. Okay. And then we will move forward and we'll start working through the techniques. This is going to save us quite a lot of time on the day now, so we can make much more, pay much more attention and have more emphasis on the actual part that we want to do, which is the massage itself. So I'd just leave you for now, and I will look forward to seeing you on the 23rd. Make sure that you're there bright and early. We will be starting very soon after 9 o'clock, so I'll be there from 8:30, and I want you to be there ready to start by at least 9:15, 9:20, so that we can get straight in and move on. Very, very full day. Okay, so I look forward to seeing you then, and in the meantime, make sure you view this video 2 or 3 times, and I look forward to seeing you on the 23rd. Bye for now.